Audio Jungle. Audio Jungle.
Grasp the wound edge with the forceps. Drive the needle through the skin using the needle holder around 4 to 8 mm away from the wound edge, passing the suture deep through the dermis. Grasp the opposing wound edge with the forceps. Drive the needle deep through the other side of the wound, piercing the skin to re-emerge around 4 to 8 mm away from the wound on the opposite side. Backward load your needle in your needle holder. Grasp the second wound edge again with the forceps and drive the needle through the skin in vertical alignment with the other puncture side around 1 to 2 mm away from the wound edge. This near placement should occur at the shallow depth and should pass through the upper dermis. Grasp the opposing wound edge with the forceps. Drive the needle deep through the other side of the wound, piercing the skin to re-emerge around 1 to 2 mm away from the wound on the opposite side. Gently pull the suture to achieve the desired skin tension as the wound edges close. Finish by performing a hand tie or instrument tie.
Audio Jungle.